you joining.
So you can feel confident coming to any Beaumont emergency center. Beaumont.org/.
All right, good afternoon and welcome everyone. On behalf of the Michigan Department of Health and Human Services, Heart Disease and Stroke Prevention Unit, the Michigan Society for Pulmonary Cardiovascular and Pulmonary Rehabilitation, and the Henry Ford Health System, we would like to welcome you to our third and final webinar where we will continue our discussion on the pearls and pitfalls of restarting cardiac rehab during the COVID pandemic. We will begin with 3 panelists and then open up for discussion. For those of you who don't know me, my name is Karen Fuller, and I'm a public health consultant with the Heart Disease and Stroke Prevention Unit. As part of our CDC grant-funded work, we have teamed up with Henry Ford and MSCVPR to increase enrollment, referral, and participation in our cardiac rehab. Today's webinar will be moderated by Dr. Stephen Catane, who serves as the Director for the Cardiac Rehabilitation Preventative Cardiology Unit at Henry Ford Hospital in Detroit, and is our grantee recipient of our 1817 program grant. We are also joined by 3 panelists, Rob Snyder, who serves as the team leader at McLaren Greater Lansing Cardiac Rehab, Lisa Sawyer, who serves as a clinical exercise physiologist at the Preventative Cardiology and Rehab at Spectrum Health, and finally, Megan Bowden, who serves as the manager of Preventative Cardiology and Rehabilitation at Beaumont Health and Wellness Center in Coolidge. A few housekeeping rules that I would like to go over before we start. We ask that you please keep your phones and computers muted until the discussion. After each panelist, if you do have a pressing question, if you could raise your hand or use the chat box, we would be happy to have a panelist answer. For those of you that have joined via the Teams link, again, there is a chat box function right next to the raise the hand function at the bottom of your screen. And as in our unit, the Heart Disease and Stroke Unit, we do promote healthy meeting guidelines. So we do encourage you to stand while the meeting, eat a healthy snack. We understand that this is over the lunch hour, so we do acknowledge that. So we can go ahead and get started, Dr. Catane.
Well, thank you, Karen, and welcome everyone. And a special thanks, as Karen said, I want to reemphasize to MSCVPR and Michigan Department of Health and Human Services for really being flexible and sticking with us and being creative and helping us along as we've as we've managed what's really been unprecedented times for cardiac to operate cardiac rehabilitation. So again, my sincere thanks. And also to Rob Snyder and Lisa Sawyer and Megan Bowden for stepping up and putting out their views on cardiac rehabilitation from their respective sites. The only really instructions we gave each of the 3 presenters is that they maybe present, and it didn't have to be the same across each of them, kind of what's working and what's not working in this COVID crisis or COVID crazy time, so that we all might share their best practices or share their challenges, and it might help us with what we do at our site. So my thanks to everybody I just mentioned. My thanks to all of you for attending. I'm really looking forward to this, and we're going to open with Lisa Sawyer from Spectrum. And I'm going to ask, just so I need to remember, Karen, will you manipulate the slides, or I think Adrian is that correct?
Sawhill will, and we are actually going to open with Rob.
Okay, go ahead.
Okay, yes, thank you everyone. I appreciate the opportunity today. So what I wanted to do was just discuss some of the changes that we've been through here at McLaren Greater Lansing. Those that are kind of working for us, those that remain a challenge since COVID-19. I'd like to open with a little bit of background and how we reopened, how we got started there. We got started back on May 11th. And we first kind of came in without patients for a few days to kind of meet with leadership and our infection control to establish kind of a new safety protocol in regards to cleaning, screening, use of PPE for both the patients and the staff, especially looking at what the CDC guidelines were and how we were going to be in accordance with them. We also wanted to develop a plan on how we were going to educate our patients to helping, ease any anxiety that they might have, and really emphasize that we're striving for patient and staff safety from the parking lot into the exercise and then back out through the gym. And so a couple of these changes that we had, first and foremost, we decided that no longer were we going to do group style orientations or education. Everything was going to be individual, and that really started with the first call to the patient during scheduling. So we let the patient know what our new COVID protocol was going to be, which I think helped ease the patient's mind a little bit as well. And what we came up with was first and staff a lot, and all the way through. And then explaining the screening process to the patient, especially screening at home, what symptoms to look for, and definitely letting them know to give us a call before they came in if they had any of those type of symptoms. And then we do daily screenings at the door and just informing the patients that those were some of the things that they were going to be expecting. We kind of changed our appointment protocol as well. Oftentimes patients, would kind of come in early or late, and we were able to flex. But now what we do now is the patient is instructed to show up at their scheduled time. So no early or late arrivals. And sometimes they do get there a little early. We have them wait in their car, and it doesn't seem to be too much of a problem. And education, again, is all done one-on-one, and no more group classes for, like diabetes or dietary, that sort of thing. Another change was staff mask wearing, and it is McLaren's policy too that we also wear goggles or a shield for all patient interactions. And so that was definitely new. And then cleaning, new protocol there is staff is now exclusively doing all of the cleaning, whereas before the patients, we had them kind of wipe down their equipment, but we do this now. And we allow 15 minutes between patient groups before another patient group comes in to make sure that we have time for the cleaning solution to dry and get ready for the next round. The staff is still hooking up all the patients for the ECGs, basically due for time sensitivity. We are still doing that, but we have, as far as our BP, blood pressures are now just based off clinical need, and we've decreased those as much as we can, just so we're decreasing, any cross contamination there. And we are limiting our gym now to only 8 patients max at a time. And so once we kind of established all those parameters, the next step was to determine who we were going to bring back and what kind of volume. So we decided to put phase 3 on indefinite hold, as our space was not going to allow for us to see both phase 2 and phase 3 patients. And that's where we are today as well. We still are not operating our phase 3. A phased approach made sense to us, so we started with patients that were previously enrolled pre-COVID, and we took the ones that were in most clinical need. And that was about 15 to 20 patients. And we did that over 5 hours, still kind of sticking to a Monday, Wednesday, Friday thing. Over the next few weeks, though, we gradually did expand our schedule in hours to accommodate a higher volume. And as we got more efficient with our new workflow, which, the screening and the cleaning, as that efficiency improved, we offered the remainder of our pre-COVID patients the opportunity to kind of finish their program. And working on the backlog of referrals too from the shutdown. So calling those that were March, April, May referrals. But we, as we picked up the volume and getting back to kind of pre-COVID levels in phase 2 regards, a couple things really helped us out. And one is the pod system. So initially we kind of social distance patients in our previous gym layout. And the areas, it was kind of a challenge to kind of track down where they had been to clean, and it was pretty inefficient. And the volume was low, and so we had a bunch of unused equipment. So one of our team members actually had a really good idea of grouping the equipment all to a single kind of area, and you can kind of see in the slide there the numbers. So that's all the equipment that a patient would use kind of in a single exercise session. And we were able to create about 9 of these pods. Most of them are identical. The difference being some are for higher functioning patients, some for lower. But it's really been great. It allows for the social distancing between pods, speed of transitioning patients to additional exercise modes, from treadmill to new step, speed of cleaning after each patient. It decreases the risk, it decreases the patient footprint in the gym. Thus decreasing risk of contamination there. But you can see also in the first picture there that we have a centrally located cleaning station, and the pods are kind of positioned around this cleaning station, and it really helps a couple different things. The speed of cleaning to get all the pieces of equipment that a patient has used clean for the next round. And it's also visible to the patient, which I think is very important, that the patient is watching us clean and knowing that we're taking steps to protect both staff and the patients. And then when you get into the mask use, oftentimes, I'm sure a lot of other places have experienced this, the patients have a hard time breathing with their masks. So we allow them to pull that down if they're having trouble breathing. And with these pods, we're able to social distance enough that we really think that that really decreases the risk of pulling that mask down and making that okay. And so that's kind of really been working out well for us, and it has been a really great thing. You can also see that we have 2 separate doors, and our patient flow through the gym. One is an entrance, one is an exit right back out to the parking lot. So we're really decreasing any patient interaction in the hallway and risk there. So another thing that we've done that's helped us is expanded our schedule. So originally we kind of did the traditional Monday, Wednesday, Friday. Now we're doing a Monday through Friday for 8 hours a day. Without phase 3, we have a lot more appointment times, and this has really allowed flexibility to capture otherwise kind of lost visits, due to patient conflicts, say like a dialysis patient, that sort of thing. So this helps us get patients through the program faster. And additionally, the flexibility allows us to offer many more times for initial evals. And I think it's really helping us hit that 20-day enrollment metric. We're able to get patients in oftentimes within about 2 weeks. So I think that's been a good thing. So some of the challenges that we still continue to face, mask use, I think this is always going to be there's always going to be a challenge. But what we're kind of experiencing is just having to constantly remind and educate patients on the proper mask use. Some are wearing it incorrectly. Some are not totally bought into the need to use it. That's, and often a difficult situation. So, it's taken some time to educate the patients that, we could be spending on educating in other areas. So that's one of our challenges. Volume and staffing without phase 3 has been kind of a challenge. And what I mean by this is, we experienced a really good July. We really had a lot of patients, and then it seems to be kind of leveling off here to maybe a more normal, where we don't have all that pent up demand. But by, kind of solely focusing on our phase 2, again, that's been great, but it's also been a challenge to keep proper staffing. It only takes a few, cancellations or no shows to really kind of put you in a little bit of a bind there. And so, kind of currently what we're looking at then is to possibly reintroducing our phase 3 program, and kind of discussing what that looks like, and how do we kind of bring that back, and maybe in a limited way to kind of help offset some of those volumes. And then lastly, we're looking at possibly, telehealth. I think we're gauging demand right now to kind of see, what we could do to reach some patients. Obviously, that the distance is an issue, but also, we're really not sure how many people just aren't coming because they're still scared of COVID, of coming into the hospital for their exercise. So that's kind of where we stand now, to kind of get back up and running. That's where we stand. So thank you. Hope this was helpful.
Rob, that was incredibly helpful, and I'm impressed that I'm impressed, even if I compare your thinking to what we do at Henry Ford, how varied our thinking is, and this is all very healthy. So we actually have maybe just a minute or two to take a question or two if there is one. I don't know if Karen, you can see a chat box or not. If any questions have come in, I don't want to take many because we'll hold the group questions to the end. But if there's a pressing question, we probably could take it. If not, we can go on to the next speaker.
Yeah, Dr. Kintain, I did see a question pop up. It says, am I right? This is from Julia. Am I right that we can have 20 patients per 1,000 square foot?
So I can honestly say that I have not seen that before as a recommendation, although I think that might have been a fitness center. Now that I'm thinking about it, that might have been a fitness center recommendation. I haven't seen that applied to cardiac rehab.
Okay, and she just commented that she thought she had heard it on the news station yesterday, which was a Lansing station. So Laura Vaughn will investigate, and I'm sure she'll share that with everyone.
All right, so I'm guessing here now, Karen, is our next speaker. I'm guessing it's Megan, but I'm probably wrong.
We're going to welcome Lisa.
Ah, there we go. All right. Well, welcome, Lisa. Thank you. And again, Rob, great job.
No, this is Megan's.
Well, welcome, Megan.
Hey, everybody. This is Megan Bowden. I am from Beaumont Royal Oak. I will be the next speaker. You can go to the next slide. So I just want to briefly go through the few slides that I have. I'm going to go over the changes we made, a quick update about what we're doing. There's a couple pictures of our space, then we'll talk about the PPE for staff and patients, staff burnout, and what they think and the education we're giving them, and then for any questions. Next slide. You can go to thank you. So this is kind of a big grid of the different things we've done pre-COVID and post-COVID. So I wanted you guys to be able to just have a chance to look at a few of the different things that we are doing. Pre-COVID, we had a lot of different programs in our space. In our gym, we had a phase 2, phase 3, and a women exercising to live longer program, all exercising simultaneously in one space. And now, of course, we don't have space for that. So we are just to phase 2 right now. Our referral timeline previously was about 2 to 3 weeks, and at this point we're sitting at 4 to 6 weeks. We still have a huge backlog of referrals to process, and we just don't have enough staff here to be able to process them fast enough. We interestingly went from a one-on-one orientation to a group orientation, honestly, simply because we don't have the staffing to support us doing one-on-one orientations right now. I actually have been doing all of the orientations as much as possible. On Tuesday, Thursdays, we have a big conference room where we're able to space everybody out. And we've actually found we really like this process a lot better because we previously were focusing so much on the patient's individual experience and what they went through in their actual disease process. And then they would come to their first exercise class and not really know what to do. And now we're focusing on what they actually do in cardiac rehab and the goals of cardiac rehab and show them how to hook up a monitor and those types of things so that when they actually come to the orientation or their exercise, they know what to do. And we're finding that that's working out a lot better in terms of the patients just stepping in and helping themselves. So even to the point of hooking up a telemetry monitor, at this point, a lot of patients are doing those on their own. We've actually been able to increase our patient population in the gym for phase 2 because we have more space because the other programs are not there. Previously, any patient worked with any staff, and it was like whoever saw the first patient, that was who you got. And now we truly have case management because we're out in the pods. So we're finding that in terms of our staff satisfaction for work, we are much more satisfied, feeling like we're really connecting with those patients. And now our patients are giving us good feedback that they feel like our staff are really understanding what their needs are, rather than every other time a different person that doesn't know what happened the last time without looking at the notes. Blood pressures we did pre and with exercise previously. Now for the first few sessions, we are actually adding an additional exercise, or I'm sorry, a post blood pressure. But if all things look good, we're going to just post blood pressure, and we're finding that is working out really well. We're only doing aerobic exercise, but we're hoping, because of the pods, I'm hoping that in a couple weeks we're going to add some resistance training to those that would like to by just putting a resistance band at their station or free weights at their station, and then dedicating the last 10 minutes or so to possibly doing like a group exercise within that pod while they're all at their own individual stations with the resistance band or those just specific weights, but not opening them up to use like all the equipment that we have. Education, previously we had laminated handouts that we used for probably about 12 of the sessions that we have. We provide an educational handout, so we're able to continue to do those. And we honestly did that a few years ago with an initiative to try to get more consistent resting blood pressures. So we try to give the patients an opportunity to truly be sitting and resting for a good 5 minutes, and that just adds that additional time for us to get a good blood pressure if they're reading the handout first. We don't have any monthly classes that are going right now. I think if you just think about it logistically, it seems like it could happen pretty easily. But then if you think really hard about the logistics of that, it takes a lot for us to be able to do an online class. So we haven't been able to do that yet. Source control for mask wearing, we didn't have to worry about that previously, aside from making sure we're cleaning the equipment. Now we're all wearing masks at the patient level and staff level, and staff are also wearing goggles. BOMA has recommended that we wear goggles over a face shield, and goggles that are actually tight to the face that don't have all the air room coming in from the side. And then just to be aware, our department itself doesn't just do cardiac rehab. We do, like I said, we had the phase 2, phase 3, and the WELL program. We do EECP therapy, stress testing, and Holter and event monitor hookups as well. So we've been able to bring most of those other things back aside from our phase 3 and our WELL program. So we can go to the next slide. These are a couple just examples. On the left is our patient station. And as you can see, there's like one of the machines that is marked off with caution tape. We still have not been able to get our extra equipment out of our gym space. Still trying to slowly work on that. But all of our pods include a chair, a table that has everything the patient's going to need. So we have the monitor with the electrodes already hooked up to it. The monitor is already turned on. They have their little tape, hand sanitizer, wipes, the blood pressure cuff. We don't have enough stands for everybody, but we do have enough cuffs that we can each use an individual cuff for the hour that the patient's with us. And then we mark the 2 pieces of equipment that they can utilize within their pod. So that's kind of their own station. And then on the right is just our tower. It's our educational tower, basically, what we call it. And those are some of the examples of the laminated educational pieces that we hand out. And we are currently working with Channel Health to try to determine if we can use this for phase 3 specifically, but we would roll it into phase 2 as well. And we're honestly just at the stages of getting through IT access and clearance within Beaumont. So I don't have a ton to share on that, but I'm hopeful that we'll be able to use that. And I'd be happy to share that information with anyone that is interested in more information about Channel Health. which I have no affiliation with, just hoping that it works out. These are a couple more examples. We have these little soiled bins that we ask people to put their equipment in. Honestly, I would tell you that the patients don't use those bins in any way, but when we're cleaning the stations, we do utilize those to put the monitors and the blood pressure cuffs in. And then the cleaning, drying blood pressure cuffs, so we have a little drying rack for them. And then just to show you, we still have a ton of equipment that we can't get out yet. PPE and patients, like I said, patients are wearing masks the entire time, and we originally did allow them to drop the mask if they wanted to, and kind of went back on that and said, nope, they have to wear a mask the entire time they're here unless they're basically taking a drink of water. And hasn't been bad. We haven't had major issues. In the orientation, I usually try to advise them to either purchase a KN95 mask or just start looking at the ones that they have so it's not sucking into their mouth. The KN95s just sit a little bit further off of the mouth, so they're not going to get sucked into the mouth as they're breathing heavy, but haven't had any major issues. And like I said, staff are wearing eyewear and masks the entire time. Staffing wise, we started back with just a couple staff. We had 3 EPs, 1 RN and a manager, and now we've increased to 9 EPs, 2 RNs, a manager, and 1 clerical staff. And we still have, I still have about 6 staff that are not back with us at this point, a few that are in different departments doing stress testing, and others that are just still on layoff and not brought back. But it was asked originally when we were talking about this, our staff burning out, and I can tell you 100% yes. My staff are all at their max capacity right now. We're working really hard. Would say everyone's somewhat happy to be here because we all have jobs right now and we're not doing labor pool COVID surge stuff. But I have really been trying to highly encourage my staff to take days off. And if there's someone that can take a class that is not on a class because they're caught up on things, switching things as they can. So we're really trying to make sure, and I mean, just even today, I got a request off for Monday and she's going to get it because I want them to be able to take the days that they can for themselves. And then we've been trying to plan a staff lunch where we have a good amount of our staff here that we can at least not have a staff meeting, not talk about work, where the director and I will, Dr. Franklin and I purchase lunch just so we can say, like, we appreciate you. We really appreciate all the help and hard work you've done to bring us back. We're trying to keep them happy, but it's tough right now. You can go to the next slide. Patients, a lot of times when we're talking to them on the front end, they're anxious to get started. Most of them have waited quite a bit at this point to get going, but they also truly understand what we have going on and how we're limited of what we can do. Most of them are glad to have the screening at the entrance and mask with exercise and seeing us clean the gym. I would say there's a few people that, get annoyed with the 13th time they're getting screened at the front of the building and it's the same questions and the same answers, but we still have to do it. And I think overall people are happy that we are. Because we've switched our processes and with case management, we truly feel like the patients are getting more education on a daily basis with the interaction with the staff member that they're working with. So I don't really have anything formal about that, but it just seems like our patients and staff are getting to know each other so much better right now that they're able to really identify what things they could work on and then really help them find the right avenue to make the changes that they'd like to make. And again, the laminated handouts, we make copies of them if anybody wants that. No classes, and then of course working on the channel health stuff. So hopefully that will work out. Move on. And then our phase 3, this is a big sore point for us. We had over 200 patients in our program previously, so we're getting them begging us to get started. And especially now with the other gyms opening up, they're really honest about opening up, but we really can't figure this out within our current space. I have at this point now reached out to 2 other departments in the building to see if during their off hours we can utilize their space. And that's looking like it's going to be okay, and we would be able to do that, but that includes us expanding our staffing hours till about 7 p.m. That includes no phase 3 classes during the day. It would be phase 3 classes from 4:30 on, which for our population obviously is not ideal, but hoping that we can at least do something for some of them that would like to be here. And then the channel health thing is really where I'm hoping that will help us stay connected with our patients, basically doing telehealth with them, where we can schedule appointments with them. We can schedule the exercises that they should do on their own, give them 3 days a week that they're doing, and then have like a once a week touch base, a virtual touch base to talk about what they're doing and provide a little bit more education. If we don't end up going with Channel Health, I'm still hoping that we can do something like that, because I do think if we can at least stay interactive with them, they'll stay motivated. And I know certain folks are worried about the retention when we can bring them back. And quite honestly, at this point, that's not really my concern. It's more about making sure that they're not sitting on their butts for the next 6 months if they've already been doing that this whole time. I lost my train of thought. I had something else, but okay, we can move on from this one. And that's it. So is there any questions about our process right away? Or we can just wait until the end?
Stephen here, Lisa, as others maybe submit a question, I just want to say in the same comment I had for Rob, the creativity that you're pulling into this to handle unique situations is very, very impressive to both you and Rob. And you went hard on a comment that we're experiencing here at Henry Ford, and it is just the staff burden now is immense in terms of fewer people in a class, more classes, having to clean equipment, anything a patient touches, and it makes for a long, heavy, hard work day. And I know everybody is happy to be employed, and we recognize these challenges, but you verbalize nicely things that you try to do to improve satisfaction in terms of days off or recognition of staff through a luncheon. But just to everybody, I'm sure you're experiencing the same, and I'm glad you verbalized it. And Karen, I don't know if we have another question come in, or we can go on to finally, Lisa. But any other question come in?
You know, Dr. Kane, I do want to just comment on that too. Thank you for your feedback, but a couple things I did want to mention also about staff, even as simple as like there was a day I brought in granola bars, or I brought in bagels, and it's like something so simple that isn't a lot. It doesn't cost me a lot, doesn't impact me a lot, but just goes a long way to show like I'm thinking about you outside of here too, and how much this is impacting your life. And then I continue to try to express to them that I know your life isn't just crazy at work. Everyone's life is crazy at home. So we just try to honestly kind of keep that in the forefront of making sure we're sort of talking about that a little bit, so we are understanding when each of us is kind of at our breaking point. It's like, go take your break then, because we can hold it together for right now. And then I forgot to mention this. Rob was saying they don't have trouble with patients arriving early. That we are having trouble with. So we are actually, honestly, I drafted a little half-page thing today, sent it to Dr. Franklin. He's editing it. We are telling patients they cannot come in until they're 5 minutes or before their appointment, and we're going to lock the door. And we're going to tell them we're locking the door. They cannot come in.
And then what you find is they touch more stuff, and then you got to go. They have to go over and clean the stuff that they touched.
Exactly.
Because they're waiting someplace. So we are struggling with something that's very similar. It's interesting you mentioned that. Or hats off to Rob that they're able to control that better than we are.
Absolutely. And Rob, if you have any suggestions for the rest of us to help keep people to their actual time, I would love to hear it.
No, I'm sorry for the misunderstanding. We are having those issues.
Oh, so there you go.
Yeah, sorry. I must have misspoke there. But yeah, we have the exact same issues. But yeah, it's a challenge.
It's a challenge.
All right, so let's just head on to Lisa, and if we and between now and when Lisa's done, please let any questions you have build. And so, Lisa, you're going to have to disclose whether you're having difficulty holding patients back or not sometime during your presentation.
Sounds good. All right, thank you for allowing me to speak as well. Definitely enjoying the feedback so far and taking notes, but yep, at Spectrum Health, I mean, definitely, initial thing, we, are definitely, they're getting better, and every day we have to tell our patients too that they can't come in 5 minutes before, and making them sit out in their car. I mean, fortunately, our parking lot is right outside of our entrance, but definitely encouraging patients to not come in early has been a challenge. And as it gets colder, I'm gonna feel more guilty about making them sit out in the car, but I think they understand once you tell them. You can move on to the first slide. So just some of the, general things that, we're tried to do when we opened, and we first started seeing patients May 11th as well. And just, what was our plan? How are we going to do it to gradually bring patients back? And, we definitely worked with infection prevention to give us some ideas on, how we can have things done appropriately. And that's where, we started off with moving our equipment further apart and placing stickers on the equipment they could use. And definitely, instead of moving them out of the gym, just designated on what equipment the patients could use. And then, definitely staff is using the face masks and the eye protection as well. And staff is doing the daily screening. And then we have screeners in the front of the lobby to screen the patients before they come in the gym as well. So you can move on to the next slide. And so we gradually brought patients back, those that were in our program prior to COVID. And we set up kind of a grid, who was, high risk, moderate, and low risk, and how we were just going to gradually bring those patients back, since we started off with just 5 patients per class. And then we did kind of space out our classes a little more, where we used to have 15 minutes, where now we have 30 minutes, just to make sure that the gym was cleared out. We had time to clean up, give staff a little break, and just branched it out. And then we also then added more classes on Tuesday, Thursday as well, just to allow more. Since we were removing a class on Monday, Wednesday, Friday, we added more on Tuesday, Thursday, just to have more patients attend. And then gradually moved to more and more patients as we were allowed and felt it safe and appropriate. Now you can move on to the next slide. So this was our gym before COVID. We have just a nice long gym, which has helped to space things out a little more. But then you can move on to the next slide. So now we have it spaced out a little more, and you can see the round stickers on the ground, just designating, what equipment they can use, and patients have been real good to abide by that as well, and just help, with those reminders with staff and patients, just to keep the distance with that. You can move on to the next. And this was some of our lovely staff before during cardiac rehab weeks, where we could see all of our smiles. And then the next slide. We're now unfortunately all masked up. But adjusting, but yeah, now trying to provide that personal touch with the patients, where before, we could be nice, close, having, good conversation with them and easily communicate with them. But now trying to figure out how we're going to, carry that on with our patients has been more of a challenge. You can move on to the next slide. So with that patient experience, we are with their initial orientation. We used to do that face-to-face where they'd come in, but during COVID and going forward, we're just doing phone orientations. So they're not having to come in that time, and we're able to do it over the phone. And at that time, we go over and explain, what's entailed with the screening process, and, how we can, make sure they're having their masks, and just explaining the whole process where how they're screened, and then just explaining, with symptoms. And when they do come in for their first orientation, we do give them a whole form that goes through, what we're trying to cover with, face covering, physical distancing and symptoms, and, how we're not using our locker room at this point, and not allowing visitors, and, how we're disinfecting the equipment. So going through that whole process with them, and then the general guidelines with them. We still are doing education classes, but with our education room, we are able to spread it out even more. And during COVID, we were going through more the phone visits, and we still are doing that with some patients that we find, not appropriate and they don't feel it's safe to come in. So we are still allowing that. And we're not doing any of the phase 3 patients still. That was more what we call a Met-Well program. So we're not doing that at this point. So those are a lot of the precaution changes that we're doing. And then so just with that patient experience, just trying to still make it where, they feel comfortable coming. Of course, we have patients that just don't feel they're able to tolerate the masks, and so they just don't return to the program because of that, and choose to exercise at home instead on their equipment. And then definitely there's those gentle reminders. Of course, you always find it where their nose isn't being covered, so just always staying on top of that with certain patients. And so far, we find that things have been effective in regards to, staff and patients that we know of haven't had any issues with COVID. So hopefully trying to keep it that way.
Thank you, Lisa. Again, wonderful presentation. You guys are really thinking. I mean, you can hear your thinking in your voice. So I appreciate that. One question I had is that you had just a one-liner up there that some patients said we're literally not going to. A couple patients said we're literally not going to come back because of have to use the mask.
Yeah, I mean, they just feel they can't tolerate the breathing and just don't want to have to deal with exercising with a mask. So yeah, we've had a few that have just chosen just not to come because of that and rather exercise at home, unfortunately.
So let me just ask the kind of the reciprocal of that question. Let's say you had a 42-year-old that for whatever reason was in your program, and he wants to jog, and functionally he probably could do it.
Mm-hmm.
And he said, would you mind when I'm jogging if I take off my mask and then put it right back on when I'm done? Would you be okay with that?
No, unfortunately, we still make those joggers still wear a mask.
So you've had some of those already and you've asked them to wear their mask?
Correct.
Okay, interesting.
Dr. Katayan, this is Megan Bowden again. We are doing the same thing, and in fact, we actually require them to wear a mask when they're doing a stress test too.
Mm.
Interesting. So throughout the whole bout of rehab, they come in with it on and they keep it on.
Correct.
Correct.
Okay.
Correct. And quite honestly, I really put this on myself as a child, and I said, if my dad were here and he has heart disease and diabetes, would I be comfortable with him exercising here with other people without a mask? And there's no way I would feel comfortable with that. And so that solidified it for me to go, we're not changing that.
Well, good comments. Thanks to all three speakers. Wonderful job. Exactly what we were hoping for in terms of real world, site specific joys and concerns. So that was perfect. Any questions from the group? I don't see the chat box building, and my guess is Karen's keeping an eye on that.
I am Dr. Katayan. So yes, we have had some comments in the chat box, and then Laura Vaughn also had her hand up. I'll start with the question from Melissa. What are programs doing with pulmonary and cardiac patients in the same space?
I can't answer this. This is Megan from Beaumont. I can't answer that because we're in different spaces.
Yeah, I can answer. I mean, with our program, we try to have most of our cardiac rehab Monday, Wednesday, Friday, and then pulmonary Tuesday, Thursday. And with the classes we added for cardiac on Tuesday, Thursday, they flip-flop the pulmonary. But we do some of our initial exercise sessions. So we just try to limit the patients that we do have during that pulmonary time and keep them a little separated.
Okay, great.
So
And
in Lansing,
No, go
No,
ahead.
go, Rob. Yeah.
Oh, I'm sorry. I was just going to say in Lansing, we were operating with pulmonary rehab for a short time, simultaneously, same days. But as of right now, they are not operating at all right now. So I don't know when the plans are to return that program. But for a brief period there, we were operating together.
Yeah, and I was just going to mention that Vicky in the chat box said that Ascension Borges is providing both pulmonary and cardiac rehab in the same space. I can move on to the next question. What kind of mask is used for stress testing?
So that my guess is that might be referring to either N95 or just basic general surgical. Megan,
This-
did you want to tackle that?
Yep, Megan again. We staff are wearing N95 masks during a stress test, but the patients are wearing just a regular surgical mask. They cannot wear their in-home mask. They have to wear a surgical mask that we provide for them during the test. And then we also, not in our department, we just moved our VO2 and PFT stress testing over to the hospital, but in those environments, the patient cannot wear a mask, and the mask that they do wear for the VO2 or PFT does not have a filter in there to source control. So the staff are wearing N95s and goggles, and also in the regular stresses, they're wearing goggles as well. And then we had to build in about a half hour of time to use a HEPA air filter. And so we have to clean the whole room, put the air filter on. It's on during the test, and then we have to leave the room for a half hour and let it run by itself to clean the air.
So Megan, I did want to share that I believe Med Graphics makes a inline filter that you can put on your mouthpiece that is designed to help capture exhaled small microns. So that might be something you can think about if your CPX lab's interested in it. Maybe just email me and I'll see if I can find the manufacturer specs and send it your way.
Excellent. Thank you. I appreciate it.
Karen, anything else?
Yes, we have a question from Megan, actually. She was just asking the group if anyone has restarted their PAD program.
Henry, for Stephen here, I think we've had one of our PAD patients return. So I'm going to say a half a yes, but I can confirm that. But I think yes.
Yeah, and we're still waiting on approval for our PAD program here, so we don't have any current PAD patients at Spectrum.
The same here in Lansing.
And for Beaumont, we haven't, but I'm feeling like we're getting to a place where we could bring those patients back too.
And this is Karen. At this time, we have a couple of comments in the chat box that I'll read for the folks on the phone. Metro Hospital has restarted their PAD program, but they have always been together with the cardiac patients. And also, Cameron from Henry Ford McComb says yes, they have
good.
also. Dr. Katane, at this time, there are no additional questions in the chat box.
Okay. So again, immensely helpful. Thanks to all three speakers. Thanks to MSCVPR and Michigan Department of Health and Human Services. We're finishing a little bit early, so we're buying you a little bit of time here in your day. But again, from my perspective, immensely helpful. So a public thanks to everyone. Karen, any closing thoughts on your end, or we can just close the meeting?
I would just like to make sure nobody else has any additional questions. Anybody on the phone, they could unmute themselves and ask. Just a couple additional comments in the chat box. Brenda mentioned that Med Graphics has a viral bacterial mouthpiece to use during the PFS testing. And then Laura commented that John did find information regarding the square footage in the governor's executive order, and they will be posting that on the MSCVPR Facebook page. So we'll give, let's say, one more minute to anybody that wants to ask any additional questions. And if there's none, we would also like to thank the panelists and Dr. Catane for facilitating this meeting. And thank you for allowing us to have 3 really good sessions in replace of the face-to-face meetings that we are planning.
I have a comment regarding people showing up early for their appointments.
Please.
Sure. I'm from Mid-Michigan, Gratiot, and we have distanced chairs and like Rubbermaid bins under the chairs that have the patient's monitor and blood pressure cuff and things like that that they will need, and then label the chairs so when the patients come in, they know where their spot is going to be, and that remains their spot throughout the sessions. So usually we have enough space where if a few stragglers come in early, they just sit in their spot, or there's a few extras where we just tell them, to have a seat, but then that is their spot for their session. So we're not cleaning extra equipment that way.
Thank you for your feedback on that. That's honestly how we have ours as well. We have the different stations and they're, if you're assigned D, that's where you go. But if that person isn't gone from the 9:15 class and you're here at 10:30 for your 10:45 because they had blood sugar issues, then there's nowhere for that person to go.
Yeah, we do have enough chairs where it's not an issue, but we have educated them too. During their first appointments, we're really kind of forward about, this is your appointment time, this is when you have to come, and most of them have been good about it. Or if they get there early, I'll say, I'm really sorry I don't have a spot for you yet, you'll have to, and then I'll send them somewhere, so then at least the next time they don't come early.
Right. I think you're right. I feel like we've been sort of nice about it because it has we wanted to be nice, and at this point we have to kind of put our foot down that we appreciate that you want to be here and get started quickly. However, during this current climate, we just can't do it. And to Lisa's point, we don't want them sitting out in their outside, so might as well just stay in your warm car for a little bit longer.
Yeah. The other thing we do with education, we have been doing group classes still. We have a room just down the hall that's large enough to accommodate that. And so for the last 20 minutes of their class, that class leaves and goes to their education. So if people do come in early, there's not a lot of people in the gym left. So that helps us as well with the space.
Karen, anything else?
There's nothing else in the chat box. Thank you for the final comments on that. I think we can go ahead and conclude. So I hope everyone has a nice afternoon, and thank you for joining us.
Thanks, everybody.
Thank you.
Thank you.
Thank you.
Thank you.